July 18th. Can we have a roll call, please?
Calling the roll, Ms. Conwell.
Here.
Mr. Hauser.
Here.
Ms. Baker.
Here.
Ms. Brown.
Here.
Mr. Miller.
Here.
We have a quorum.
Is there anyone, Madam Clerk, anyone signed in for public comment?
No, no one has signed in.
All right. Approval of the minutes from the June 6th meeting. Can I have a motion, please?
I so move.
Moved and seconded. All in favor say aye.
Aye.
Minutes have been approved. We have two matters before us today, and if you could read the first item into the record, please.
Resolution number 2018-0152, making an award on requisition number 42513 to AmeriCab Transportation Incorporated in the amount not to exceed $8 million for Medicaid non-emergency transportation services for the period 9/1/2018 to 8/31/2020.
And who is here to speak on this? And Madam Clerk, do you know who will be here to speak for the ordinance? All right.
Good afternoon. I'm Sharonda Eisler Hunter, and I'm the Net Transportation Coordinator for Cuyahoga County. This contract is for the Net Transportation Program, which stands for the Non-Emergency Transportation Services to and from Medicaid facilities for ambulatory clients requiring dialysis, chemotherapy, radiation, and methadone treatments. The service area is Cuyahoga County. The contract period is September 1st, 2018 through August 31st, 2020. The contract amount is not to exceed $8 million. The clients must be Medicaid eligible and ambulatory, which means they have to be able to get in and out of the vehicle on their own with no assistance. Treatments covered are limited to dialysis, chemotherapy, radiation, methadone treatment services are for approximately 600 clients per month, and we do about 20,000 one-way trips per month. Transportation services are required 7 days a week from 4:30 a.m. to 12 midnight. Health and Human Services, HHS, we determine the eligibility, we confirm the appointments. We provide a monthly schedule to the contracted provider. Selected providers transport each client to and from their respective appointments. The selected provider is required to submit us a monthly invoice detailing each transport provided. The RFB, request for bid, was issued on May 9th, 2018. The pre-bid conference was held on May 18th, 2018. There were 7 entities that came to the pre-bid conference. The RFB was closed June 16th, 2018. We had 2 bidders, Emmanuel Ventures and the AmeriCab. Emmanuel Ventures were deemed non-compliant because they failed to submit the required bid bond. So the AmeriCab was the successful bidder at an amount of $15.55 per one-way trip. Any questions? $15.22 per one-way trip. Correction. Questions?
Yeah, since you're on corrections, the legislation before it says 8 million, and
Yeah.
you stated in your description 1 million. So
8 million?
Oh,
Oh,
okay.
yeah, I said 8 million for sure, yes.
Okay,
Sorry.
might be my ears. Okay. Services, are these services for adults and children, or just adults?
Yes. Sometimes children. Yes,
Okay.
both.
Any questions from the committee? Yes. Councilwoman Brown, then Miller and Baker. That's who I saw.
Can you once again, maybe I missed it, list the what classifies as a non-emergency? Are there any limitations or what categories do you cover as non-emergency?
We really concentrate on dialysis patients, chemotherapy, radiation, and methadone treatment.
So,
But a person, Medicaid, they have to have Medicaid to be eligible.
Medicaid. I think I was in a meeting with you, Councilwoman Conn, where we had a situation where someone needed services outside of these kind of medical needs. So if they needed assistance with getting to another type of appointment, a doctor's appointment, or even an emergency to get prescriptions or something like that, is that a service that would be available to them through this transportation?
Not the prescriptions, but we
Okay.
do, if people are very ill and the doctor can say that they need this service, we have done, other things if people are like just had surgery.
So it's just primarily medical, not
medical.
specific to other maybe medical needs as a result of that, again, like prescription pickup or something like that.
Councilwoman, Walter Parfiowitz from Health and Nutrition. We also offer transportation through a vouchered process. This contract is for those treatments that are for chronic illnesses that require repetitive treatments. So these, for example, chemotherapy, dialysis, would require on average 3 trips per week, so it would be 6 one-way trips, or the methadone, which requires 7 trips a week or 14 one-way trips. I believe what you're referring to is a sporadic visit to the doctor or a dentist, just as long as a client is Medicaid eligible. We transport those through a vouchered process where we use the city taxi cab rate.
Okay, and what about pregnancy services?
Those are covered as well.
Okay, thank you.
Walter, how do we identify these clients that get this specific?
Generally, they come through the Dcfs process. They're referred to Sharonda's area, the transportation area, through an application process. Medicaid eligible, then you can come up to the department and fill out a appointment verification form. We verify that you were determined eligible for Medicaid. We verify that you have an appointment that a doctor has signed off on, and then we schedule you for transport.
Okay. Councilman Miller.
Madam Chair, what was the price per ride that was in the other bid that was not accepted?
Councilman, the other one-way trip was $14.99 from Emmanuel Ventures.
So 20 cents a ride over this large of a contract, you're probably talking a couple $100,000, am I correct?
Correct.
Do we know why the bidder did not have a bid bond? Was it an oversight, or are they not able to get one, or what do we know about that?
I believe the bidder did not get the bid bond, wasn't able to. This is exactly what happened 2 years ago, same RFP.
Do we know why they were not able to get it?
I'm sorry, I do not know, Councilman.
Would it make sense for us to contact them and in the meantime, before the next contract, and see what we can do to help them be able to get a bid bond? Because it seems like it's clearly in our best interest to have more than one capable bidder for this contract.
I will do that. I will contact them. I know the bid bond is not cheap. That's probably the issue. It's an expensive process.
Okay. But am I correct? The expense on the am I correct? The expense on the bid bond is not incurred unless they get the contract.
Councilman Samantha Powell, Office of Procurement and Diversity. The bid bond is required for all bidders. It was $150,000. The awarded vendor is then required to submit a performance bond, which AmeriCab has submitted. Emmanuel, we went back and forth with them about the bid bond requirement, and they were not able to get it in the time, even though we had been contacted them weeks before about what the requirement was.
So we ought to work with them around this process between now and the next time.
Agreed.
Okay, thank you.
Yeah, because it's like AmeriCab is a sole source. We could be saving a couple $100,000. So I'll open
Yeah,
it up.
AmeriCab is also, AmeriCab has had it now for 10 years.
And now we know why. Because so we need to do some, and I thought we had did some work with that, Councilman Miller, before in procurement, the big bond issues. Councilwoman Baker.
Thank you. I'm not real familiar with this, so can you help me with the amount of money and where it goes? The $8 million is for 2 years, so it's $4 million a year.
Correct.
And you were saying that there were 600 trips a month?
Correct.
And is that, is there more than one vehicle, or is that,
Oh, yeah. AmeriCab has to provide us with a list of vehicles and
is that 600 per vehicle then?
I'm not sure. I don't have those numbers.
I'm just
with
trying
me.
to run down the numbers. If it's a 1522 one-way trip, then it's $30.44 round trip, which I would think most people would need as a round trip.
Correct.
How do you get to the 4 million a year? What else is in there besides just the 600 trips per month? Because it doesn't seem to add up.
If it does add up, it's a combination of the chronic illness treatments, the ones that are 3 times a week or 3 appointments per week or 6 trips,
Okay.
combined with the methadone, which are 7 times a week or 14 trips. That's now sort of taken over this process.
Is it a total, though, of 600 trips a
600,
month?
600 is the total. Oh, I'm sorry. 600 is the total number of clients
Of
served.
clients,
We
okay.
are doing,
That helps.
we're doing almost 20,000
That's
trips
better.
each month. I'm sorry.
Okay, got it. That was my question. Thanks for that clarification.
Certainly.
Councilman Hauser.
Just a quick question through the chair, back to Councilman Miller's point. Did we try to negotiate at all with AmeriCab as far as the price per trip?
No, this was a request for bid, so we took the lowest and the best bid.
Okay. Just back to Councilman Miller's point, I think it's in our best interest to try to find, especially if they have had it for 10 years, to try to find, so we can save the taxpayers money.
Yes, it's the last 10 years.
All right, it looks like this can go its natural course.
I think so.
Okay, yeah. Any other questions in turn?
Couple more questions.
All right, Councilman Miller.
Regardless of the pricing, how satisfied are we with the service provided by AmeriCab?
Oh, we're very satisfied. AmeriCab provides us with a very quality service.
Great. And other question is to what extent do we have similar services available for people who are not Medicaid eligible, and if so, how are they provided? How are they funded?
We'll talk about the Dcfs services.
Yes, because I formerly worked with the Department of Senior and Adult Services, I knew to tell my staff to refer back to Dcfs. So we do make a lot of referrals back to the Department of Senior and Adult Services, who has a hotline. And because I work with the Program of Options and Community Social Services, we often send people back to that program. And they have transportation services in both programs, but definitely the Options program, they really concentrate on medical appointments and getting seniors and disabled adults to their appointments. So I'd make a lot of referrals back to DSAS.
Okay, thank you.
So are you saying, Ms. Hunter, that the $8 million covers seniors in the options program as well?
No,
No,
when they
okay.
call us and they are not, he has spoke to people we have to turn away who don't have Medicaid. And so sometimes, the options program allows people who, make a little bit more for that program, they may qualify. So people are very happy to know that at least there's some other options when we can't service them.
And this $8 million that we spend, is it required by state law? How did we come about transporting?
It is.
Right.
It's 100% reimbursed by federal Medicaid. We contract for $8 million over 2 years. We've been running at about $3.2 million a year. So we spend about 7.4.
That's helpful that we're reimbursed. And you said 100%.
It's 100% federal.
Okay. Any other questions? Councilwoman?
Does this include those that are in the hospital that need a ride home?
We do
It
a
does.
lot with hospitals.
You do.
We have staff that work directly with Cleveland Clinic and University Hospital in the Metro. We try to keep it a little quiet, but the word is out on us, and so we make a lot of. We do a lot with the hospitals, a whole lot of work with the hospitals.
How about with our nursing homes for those that are able to go back home?
No, it's not allowed for nursing homes. That is the one thing that the contract does not allow. We cannot transport back and forth to nursing facilities, no.
All right, thank you.
You're welcome.
Councilman Hauser?
Just another quick question. Have our demands went up over the years as far as or is it 8 million every year, or has it grown steadily?
You want to read them off?
Sure.
2010.
Okay. I know for me, yes. 2010, 1.8 million. 2012, 2.4 million. 2014, 3.6. 2016, 8 million. And of course, this year we'll have the other 8 million. So we probably may surpass this year.
Okay.
And just to note, the big increase there was due to the methadone population. Previously, we didn't transport the methadone population.
So when did we add that? In 2016?
About 2012, 2014 contract during that time period.
To add the methadone?
Correct.
Okay, but it didn't spike till 2016.
It really didn't spike up until the 2014 to 2016 contract, which went up to $8 million.
Kind of like double, almost.
Yeah, they're being transported, 7 trips per week. I'm sorry, 7 appointments per week, so it's 14 trips for the
And
methadone.
you said that's in the ORC code, or that
It
we
is.
have to do that?
It is. It's part of the policy in Medicaid.
Okay. All right, any other questions in terms of this? All right. Councilwoman?
Are the cab drivers equipped with any with the prescription to assist if someone is experiencing? We're doing these trips, but are they equipped for that?
I don't think they're equipped for that.
Okay.
They're taking them for the treatment every day. They're taking them for the treatment to have that service, and they start very early in the morning. So a lot of them are at the methadone clinics at like 7. Some are there, for a couple hours, and then there's some clients that are there all day getting treatments. So they get them there for that type of service so that there's no issues.
Okay, and I just want to be abundantly clear. Prenatal care does fall within this category because we're doing a lot of work as the county with attacking the infant mortality issues. So prenatal care is covered.
Yes, I speak with a lot of young mothers who are very ill and cannot take public transportation. And as long as they get the doctor form to us, and sometimes we fax for people, and I've told my staff sometimes we just got to go a little extra for people who cannot move around. So we do. I know for a fact we definitely transport pregnant mothers through the voucher program.
And is that widely marketed, or is it just how are individuals to learn about the program? Because that's one of the obstacles the Infant Mortality Advisory Board is facing, making sure that particular constituency is aware that this service is something that they are entitled to as Medicaid recipients.
Since I've been a coordinator, I have worked really closely with the the Paramounts, the United Healthcare, those providers, for some reason, they give everybody my phone number, but I work a lot with them, and a lot of the nurses and social workers in the hospitals call me and my staff directly when they have a patient that really needs our services through that. But we work a lot of referral through Paramount, United Healthcare, and CareSource.
So in some way, it's at the discretion of the medical provider?
Yes, they do. They know a lot about us, believe me, they do.
Okay, all right,
But
thank you.
also, anyone who comes in for Medicaid redeterm will also be informed about the program.
Are we tracking which group is utilizing the services? Are we keeping a tracking record of methadone, pregnancy? Are we keeping a record of how's that's breaking down?
I actually put that together just for this meeting. For example, the month of May, we had 646 clients in the non-emergency transportation program. 301 of them were methadone, so 46.6% were methadone. We did 18,168 trips in May, one-way trips. 13,019 were methadone clients. 71% of the trips. 46% of the clients, but 72% of the trips because of the frequency,
Okay, can you send me that information?
certainly.
Thank you. But so you put that together for this meeting, but is that something in going forward that you'd like to track that data to see?
Of course.
Okay. Councilwoman?
Can you share the remaining breakdown? We got 46%, so what would be the pregnancy and the other categories that you monitor?
That I don't have. They're grouped with the others because we
Okay.
consider those to be more for a medical purpose versus a methadone purpose.
If I could respectfully and humbly request that we do identify those, I think it would certainly be valuable data to the Infant Mortality Advisory Board that we serve on, if we could have that information available as well.
We'll take care of that.
Thank you very much.
Any other questions? Councilman Hauser?
Just another quick question. Walt, you keep saying one-way trip. Is it often that people take the cabs there but don't need a ride back?
No, we're always scheduling both
So
ways.
all of them
but
are round
yeah,
trips?
The RFB is structured so that the provider gives us a per one-way trip fee.
Okay, which is $15.22 per ride.
Hold on, let me just verify that. I'm sorry, it's $15.66 per one-way trip. Yeah, that's what I had. I'll share the tabulation sheets with you as well, so you can see what they actually were. This comes from Office of Procurement and Diversity.
Thank you.
Any other questions? All right, hearing none. Can I have a motion to move R2018-0152 to the full council? Is there a second? Moved and seconded. All in favor, say aye. Aye. Thank you. Thank you
Thank you
both.
for your time. Thank you.
Thank you.
Thank you.
So you'll just send that, Walter, to everybody on the
I will.
committee?
Yeah.
Okay. You can read the next item into the record.
Ordinance number 2018-0007, enacting section 205.10 of the Cuyahoga County Code to establish the Division of Children and Family Services Advisory Board.
All right. Good afternoon, Director.
Good afternoon. So I'm here today to look at the ordinance to establish a DCFS advisory board. The board members, we are considered, would be about membership of 10. Members would hopefully consist of some of the following groups. A medical professional with knowledge of child abuse, child welfare or social work expert, neighborhood collab representative, community member, a birth parent, a foster parent, and a child who had aged out of the child welfare system. We would hold the board meetings on a quarterly basis. The board would be staffed by myself as well as my deputy directors. There would also be an employee of DCFS who would handle the administrative functions of the board. The board would serve as a link between DCFS and the community that we serve. The board would provide independent feedback and perspective. Some of the things we could see the board being involved in, the review and receiving of data reports about the work of the agency, the review of changes we make to policy and procedure, keeping the board up to date on changes in state, federal law, policy that impact child welfare. The board may receive presentations on special programs or initiatives being introduced by DCFS, provide professional and community feedback to DCFS leadership, help share information about DCFS with larger community and professional networks. The board members would be appointed by the county exec and confirmed by council.
All right, can you send us a description? That was too many. A description of what you
What I
just,
just said,
yeah,
absolutely.
what you just stated is.
Absolutely.
Because I think those go to the point of my question of what would be the linkage and what would be the view of how you, your agency is looking to utilize the community board.
So I think what we have learned from our listening tour is how much work we have to do on really educating folks on what the agency does and doesn't do. I could see this board as being an extension of that. Number one, they would be bringing information to us about concerns from the community or things they're hearing, but it'd also be an opportunity for us to really provide more information about the day-to-day operation of the agency and the work of the agency.
One of my, when I first saw this ordinance, one of the main focuses that I had is because it was established before and it kind of fell off. So I was thinking that not to be able to have that issue occur again, I don't know who actually drives the meetings. Would it come more from us or the community? I know right now we're heavily engaged with the issues that are before us in the community now, so it's on everybody's radar. But so it doesn't fall off again, I had actually thought, and I didn't put this in an amendment because I wanted to bring it up with some of the other committee members, why it, and I wasn't the sponsor of this ordinance, so I didn't want to do that without bringing it up, where we could look at some other areas of HHS to open it up a little bit more comprehensively, so it doesn't have the issue of falling off like we have a lot of issues with seniors, you know, job and family services. So I'm just throwing out that idea to see if that would be something that would be possible, or if you just wanted to keep, because we don't need several boards just popping up everywhere, so.
I guess if we were to do that, we would have to think about how we would staff. So if we were going to deal with senior issues or JFS issues, we would need support from leadership of those agencies to be a part of that discussion. And frankly, it might change the membership of your board. A foster kid aging out isn't going to have necessarily a lot of information or concerns about senior citizens. So I understand your perspective. I think, though, it would make it a little more challenging to staff the board.
Okay. I think we can get around anything, but I just was
Absolutely, we can.
thinking about that, just so it wouldn't fall off. And I know it would take some require individuals actually planning that agenda and knowing what that agenda was going to entail for that quarterly meeting.
That's right.
Would it entail some senior and adult services stuff or just DCFS? So I just, you know, kind of like reestablishing this board, and I just don't want it to fall off again. So we just got to make sure it has enough teeth. I would say, I also want to know, are you going to allow the board, once it's established, they get to pick their own chair, but is it our intention to allow them to set up how they want to meet, or the agency is trying to control that a kind of a way?
I think that once board members are established, that the first meeting would be exactly that conversation. Who will serve as the chair, what roles and responsibilities, we would agree on meeting times and places. I think all that is.
Times,
Yeah,
okay.
absolutely.
Okay. I want to open it up. I have some other questions to committee. You have 7? Oh. I was like, she turning the Greenspan. Go ahead, Councilwoman.
Thank you, Madam Chair. Okay,
Baker.
thank you. I have a few concerns with regards to the makeup. How are the recommendations of these 10 independent perspectives being made if they are going to be? It looks, if I'm reading this here, up to 10 members who shall provide independent perspective and feedback to the county and Cuyahoga County Division and Family Services. And these are by the county executive?
So we believe there would be an application process that would be reviewed by the county exec and council, and then the appointments would be made. So people would be able to make application if they were interested.
So they would apply and would be appointed by the county executive subject to our confirmation, is what you're saying?
Correct.
And the Division of Children and Family Services will be staffing these meetings?
Yes.
Okay, and I understand that there is a sincere effort here, but it doesn't seem that it would meet the needs of what we're calling an independent advisory board. If it's staffed by our organization and appointments are recommended from the county executive, I'm not sure that we are really providing an independent perspective, if you will. So that is a concern. We also have 10 members, and I understand they don't have any advisory, that their only duty is advisory and do not have any decision-making authority. But if there were a vote of the 10 people and there was a tie in some sort of issue, how would we manage that? So would we consider adding an additional person? Has there been any discussion around the composition of the organization with regards to profession, with regards to inclusion of maybe faith-based organizations and people who are actually in the system? What is the composition of the 10 people? Can you share that with us?
Sure. Some of the ones we suggested was someone with social work or child welfare expertise, a medical professional with child abuse neglect expertise, community members, neighborhood collaborative, birth parent, foster parent, former youth in foster care, but absolutely the faith community is a great idea. During the listening tour, we had a pretty good attendance at some of the sessions with faith committee, and we've had some good discussion with the faith community all about they are mandated reporters. And the whole discussion of, we've had one minister step forward and say, so what do I talk to my parishioners about from the pulpit? So I definitely think the faith community is a huge idea, absolutely.
Education at all? Any schools or preschools or?
So certainly we could. I think the struggle is if the committee gets so big, so it's trying to figure out what is the right size. But I
Right.
think absolutely the role of any of the mandated reporters, whether school personnel, hospital personnel, I think that, I don't know who would apply for this, but I think what would make sense is if someone could play more than one role.
Exactly.
So that you could have diversity to your team, you know what I mean? So I might be a minister, in my daytime job, I do this, or, you know what I mean? I think
Absolutely.
I think there's real validity to that. You get a better mix of expertise.
So I think it would be helpful if we would more clearly define the composition of the advisory board, and if at all possible, when we're reviewing the applicants or when the county executive, I'm sure he's watching, hi, Carmen Budish, if he would consider what you just recommended, if there are individuals who do apply that would cover multiple categories, I think that would be wise. Or if we just broaden the category as to mandated reporters, and
Right,
then,
right.
you know, we could cover multiple
Yes.
multiple
absolutely.
areas, but I think that is something that needs to be more clearly defined before we determine
Okay.
who is going to be on this board.
Okay.
Thank you.
Councilwoman Baker.
Thank you. Yes, this is probably, I don't think it's been said, but I probably assumed, these are all volunteer?
Yes.
They're all volunteer. And are there any expenses associated with this outside of the people that you would be asking for any
No,
revenue?
none that I can think of.
Okay. And maybe it was said earlier, but how often are you anticipating that they would meet?
Quarterly?
Quarterly. And would they be meeting in public places and encouraging people to come to view their concerns? Or is this just among the 10 people to,
I think once the panel is established, that would be part of the discussion that would need to be had. I think it's possible for the board to meet in DCFS, or if the board members choose a more public setting, I think that's possible too.
is the intent of this panel to be out like the listening tour? That in, maybe 2 of the 4 meetings that they go out and advertise that they're going to be there and have their public scheduled quarterly meeting, but public is invited for any concerns they want to express?
We didn't think of that, but I don't know that that couldn't be an opportunity. I mean, at DCFS, we are still thinking about our next steps from the listening tour. So we've gathered a lot of information, some themes. We really need to think about going forward, how do we continue this dialogue with the community? So, no, we didn't think about it for this, but it doesn't mean it couldn't be.
And in the strategy or structure of the panel, are they given statistics and information to discuss, or what do they focus on each time that they are meeting?
So again, I think some of that will really depend on what they're interested in. So, with the listening tour, with our recent fatality, we've heard a lot of myths about the agency. And so I think there's opportunity. We gather multiple sources of data about the families we serve, what the outcomes that happen. And so really, I think it could be driven by the board. So if the board was significantly concerned about aging out youth, then we would focus data around that issue.
Okay.
If it is, what's the likelihood of re-abuse or neglect, we could share that information. So I think where we need to be careful is we have so much data and so much to share, we would really have to think about how they would like to receive it in a way that makes sense, that could be useful.
And are they given the responsibility of choosing the topic? Is
I think
that-
we could share responsibility for that, but I certainly think it should be driven by their desire to know more about the work.
All right. And lastly, is this report that they meet quarterly, is that shared? How would we know the outcomes of their discussions, what direction they're going in, things like that? How do we know the results that are obtained by their getting together and discussing?
So we could produce possibly quarterly meeting minutes that could be shared with council as well as with our administrator.
All right, thank you.
Or we can open it up for them to come to the HHS committee and let us know from their viewpoint what is happening and transpiring
Good
as
idea.
well. Any other questions? Councilman Hauser?
Well, I personally, I love the idea of this board. To echo Councilwoman Brown, I think we have to, I love the idea of this board if done right. I think to be truly community-based, back to Councilwoman Brown's point, I'm not sure that the county executive should appoint every member of this board, because what happens even, a lot of people pick names that they recognize or that they know. We should have a certain amount of qualifications for each board member. I definitely think we should have someone in the preschool or early childhood sector on this board. But I didn't know that we had attempted this before and failed. But I love the idea if done right. And so I just think we have to make the effort, make sure it's community based, make sure we do it right. But I think it's a great idea, and I think it's a great starting point.
Thank you.
Councilman Miller, did you have anything? All right. So some great points have been brought up. Let me see. And then there was a section, I don't think we discussed term limits. On the previous board, it was stated for 3 years, but a reappointment for possible 1 additional term. I believe in the proposed substitute, it's actually for 4 years. It's not far off. It's pretty much adds up to be around the same thing. Is any issues with that thought? Yes.
much like ourselves, I think that having a 4-year a slate of the entire membership could risk losing institutional knowledge and data if that entire slate should change. So maybe some way of staggering the terms should be considered. So that's just my personal opinion. But if we're going to have 4-year terms, and that could also improve the likelihood of us continuing this, because the entire body would not
All get
all
tired.
be gone at the same time, and so we could ensure longevity if we had staggered terms.
All right. Any thoughts on that? I like that.
I think it's an excellent
Yeah,
point.
that was a great one. So quarterly basis. So we're gonna leave this in, I don't know. I guess it depends if we can move it out of committee and have it, because it needs 3 readings to keep the ball moving. If you could make sure that you're gonna define the compensation of the board before it passes. Amendment to, the appointments have to be discussed, not all coming from the county exec. And then the staggering terms, longevity. So if we can have some faith that those things will be ironed out, we can move this process and instead of keeping it in committee. Is that something that's a possibility?
Well, I believe so. We'll have these conversations here in the next couple days.
Okay. All right, any other questions in terms of, Councilwoman Brown and then Miller?
I know the good thing about the county executive's appointments is that those will be presented in an open forum as well, so they must be confirmed by us. So that does give us a little bit of confidence. But to my colleague's point, Mr. Hauser, I think it should some certain favorable and strong consideration should be given to the fact that the county executive might not be the only person with appointing authority. So I just want to reiterate the point, and thank you again for putting this together. I should have started my comments with that. So your work is truly appreciated, and so we just want to see it be done properly and successfully.
Absolutely.
All right, thank you.
Councilman Miller?
Just a comment that I agree that the limit of 2 terms is a good one, and we should consider incorporating that into the legislation. Thank you.
Yeah, I believe that was in the proposed substitute, to give at least 2 term limits, but if they're staggering terms, which is a great point. So I don't know if, go ahead.
The substitute says appointments to the DCFS board shall be for a term of 4 years, but I don't think it mentions the limitation.
I got several copies here, so it may have came in and out. Did I ask the question, is it the intent of DCFS to allow the board to create their agenda in some kind of fashion? Did I ask that?
Absolutely.
Okay, so my only concern, I love this, I think it's what many of the community leaders have asked for at the listening tours, have written to us. So I think it's a step definitely in the right direction to get this board reestablished. Just my only concern would be is making sure that we really give a broad thought so it doesn't fall off. We get things manageable and kids are remaining safe, then it's kind of not like but there's a lot of legislation and a lot of things that needs to be changed downstate. So maybe if some of those conversations are spurred along, we can actually utilize this volunteer board, which I'm assuming people will have interest about children safety that will join, could actually maybe facilitate helping us push that agenda downstate. So that's kind of what my mindset, and hoping that'll happen. I just don't want it to fall off. All right, so we can, I would say that we are, can I have a motion to move the proposed substitute as it is at the moment, for second reading?
I'll make the motion.
There a second? A second. All right. All in favor of moving the proposed substitute as it is right now for second reading, say aye.
So, just for clarification,
I knew I was messing up.
just for clarification, this is a two-part motion. The first part to accept the substitute as the current version, and the second part to refer it for second reading.
All right, so we're gonna do it by the book. Can I have a motion to,
It's okay to do it that way.
okay,
Yeah.
all right. So all in favor of doing the two-part amendment, say aye.
Aye.
Aye, all right. So,
Thank you.
Thank you.
Walter, you're not going anywhere anytime soon, are you? No, I don't have to ask a question, I mean, just
No.
for after? Oh, okay, thank you. All right, anyone signed in for public comment?
Yes, one person, Ms. Walker Brown.
Okay. All right. Please state your name.
Ms. Walker Brown, can you press the button?
Oh, I think she on, ain't she? I hear her clear.
Okay, listen. First of all, that AmeriCab, with us spending $8 million for 4 years, they need to have some CPR, some life-saving skills. And Medicaid states that non-medical transportation drivers have to have some CPR and first aid. Paying $8 million, you taking them to a hospital. What if they have a seizure? What if they pass out? What if all of a sudden they're not breathing? What are you gonna do? We paying too much, $8 million. Y'all need to do some, we need some certified CPR first aid, because Medicaid has non-transportation providers who are trained to do non-medical. Okay? Now, let's move on to them two that just left from up here. Y'all, they gave out a report. The review committee gave out their report on June 28th. They released it to County Executive Buddhist. On June 30th, there was still a listening tour going on. So I'm wondering how they done collected all the data when the report was already filed and sent to County Executive Buddhist. So they haven't listened to all the people, because the bottom of the line on the 30th, them two said they would give 3 additional listening tour sites because they were poorly attended. They had an overkill of staff and not enough community. They didn't have but 3 to maybe 8 people in the community at each listening tour. And the reason I know, I sent my people there to verify. Okay, so we need either this council to give us 3 more listening sites, or we need them to provide 3 more listening sites, because it was poorly attended. Okay? Second, this here advisory committee that was recommended to Armand Buddhist as one of our demands from the sleepover committee, we asked that you have 4 community people. I notice how you guys will want to put all these educated folks on there, but most of them ain't got complaints against the Department of Children and Family Services. Most of them don't have complaints. Their children aren't in DCFS, right? So I need you guys to put on 2 parents that have open cases, another parent with a special ed, and I also need you to put on a foster care parent with an open case. Second thing, I need y'all to be able to appoint 4 people from the community, not just the county executive, because you guys represent us. We vote for you. Do y'all want me to stop, or can I get a little leniency?
You can get a little leniency.
Okay, now, I need you guys to, have some control as the council, because we elect you guys. You make sure they get paid, they're not elected. But just like County Executive Amon is elected, I need you guys to be able to hold 4 slots for parents to be on this here advisory committee. Thank you.
Thank you, Ms. Brown. Anyone else?
No, no one else has signed in.
All right, any miscellaneous business? All right, hearing none, meeting is adjourned.